Diabetes is a condition many people live with every day. It affects how your body uses sugar for energy. When blood sugar levels stay too high for too long, it can cause serious problems. One of the most common and difficult complications is called diabetic neuropathy. This is a type of nerve damage. Think of your nerves as tiny electrical wires that carry messages between your brain and the rest of your body. They tell your muscles to move, allow you to feel touch, and control functions you don't even think about, like your heartbeat. High blood sugar acts like a slow-acting poison to these delicate wires, damaging them over time and disrupting their ability to send clear signals. This damage doesn't happen overnight. It is a slow, creeping process that often starts in the feet and legs. At first you might feel a strange tingling, like pins and needles. This can progress to a burning sensation or sharp, stabbing pains that make it hard to sleep or even wear shoes. For many, the most dangerous part is the loss of feeling, or numbness. When you can't feel pain, heat, or cold in your feet, you might not notice a small cut, a blister, or a burn. These minor injuries can become serious infections, sometimes leading to devastating outcomes like amputation. This is why finding better ways to treat diabetic neuropathy is so incredibly important. The impact of this condition extends far beyond physical symptoms. It can deeply affect a person's quality of life. The constant pain can be exhausting, leading to anxiety and depression. The fear of falling because of numbness can make people less active, which can worsen their overall health. Simple activities like walking to the mailbox or playing with grandchildren can become monumental challenges. The emotional toll of living with chronic pain and disability is immense. It changes relationships, it alters daily routines, and it can steal a person's sense of independence and well-being, making the search for effective solutions a top priority for doctors and researchers. For a long time, the main focus of treatment was on managing the symptoms. This usually meant using medications to control the pain and, of course, working to keep blood sugar levels in a healthy range. While these steps are still essential, they often don't reverse the damage that has already been done. It's like trying to quiet a fire alarm without putting out the fire. The underlying problem, the damaged nerve, remains. But now, a shift is happening in the medical community. Scientists are looking beyond just managing the pain. They are exploring innovative ways to actually heal the nerves and restore function, offering new hope to millions of people affected by this silent attack. One of the most groundbreaking ideas in treating diabetic neuropathy comes from Dr. Lee Dellon, a surgeon at Johns Hopkins. He looked at the problem from a different angle. He noticed that in people with diabetes, nerves often become swollen. This swelling occurs inside tight spaces in the body, like tunnels made of bone and tissue in the ankles and feet. Dr. Dellon believed that these swollen nerves were being squeezed or compressed within these tight passages. This constant pressure, he argued, was a major reason why the nerves were not functioning properly and were causing so much pain. It's like a garden hose that gets a kink in it, the water can't flow through properly. Based on this idea, Dr. Dellon developed a surgical procedure called nerve decompression. The concept is straightforward yet revolutionary. During the surgery, a doctor carefully makes an incision to find the compressed nerve. They then release the tight band of tissue that is squeezing it. This gives the nerve more room, relieving the pressure. It's like unkinking the hose. By freeing the nerve, the surgery aims to restore its normal function. The goal is to stop the pain, and in many cases, to bring back feeling to areas that have become numb. This is a significant departure from simply prescribing medication for the symptoms. The results of this surgical approach have been very promising for many patients. People who have undergone nerve decompression surgery have reported remarkable improvements. Many experience a significant reduction in their chronic pain, allowing them to sleep through the night and reduce their reliance on powerful pain medications. Even more importantly, some patients regain sensation in their feet. This is a life-changing outcome. Being able to feel the ground again helps with balance and reduces the risk of falls. It also means they can feel a small pebble in their shoe or a cut on their foot, preventing the kinds of dangerous infections that can threaten a limb. This surgical technique challenges the old belief that nerve damage from diabetes is always permanent and irreversible. Dr. Dellon's work suggests that in many cases the nerves are not dead, but are simply asleep because they are being choked by pressure. By giving them space to breathe, the surgery can awaken them. This offers a proactive treatment option for people who have not found relief from traditional methods. It represents a fundamental shift in thinking, from passively managing a decline to actively intervening to restore health. This surgical innovation has opened a new door for treating a condition once thought to be a one-way street. While creating space for nerves is a huge step forward, another piece of the puzzle is equally important: blood supply. Your nerves, just like every other part of your body, need a constant supply of oxygen and nutrients to survive and function correctly. This vital delivery service is handled by your circulatory system, specifically tiny blood vessels called the vasa nervorum, which means vessels of the nerves. Think of these vessels as a river of life, flowing alongside the nerves and nourishing them. Dr. John Cook, a researcher from Stanford, has done extensive work showing how crucial this blood flow is for nerve health. In people with diabetes, high blood sugar damages these tiny blood vessels. The vessel walls become thick and stiff, making it harder for blood to flow through them. This process is called microvascular disease. As the blood supply diminishes, the nerves are essentially starved of the oxygen and nutrients they desperately need. This starvation contributes significantly to the nerve damage we call neuropathy. Dr. Cook's research highlighted that you can't have healthy nerves without a healthy blood supply. It doesn't matter how much space a nerve has if it isn't getting the fuel it needs to work. It's like having a perfect, unkinked garden hose that isn't connected to a water source. Dr. Cook's discoveries emphasized that any successful treatment for diabetic neuropathy must also address this issue of poor circulation. His team explored ways to improve blood flow to the nerves. They found that certain substances could encourage the body to repair and grow new blood vessels. This process is known as angiogenesis. By stimulating angiogenesis, they could potentially restore the river of life to the starved nerves. This would provide the building blocks necessary for the nerves to begin repairing themselves. This focus on the blood supply adds a critical dimension to our understanding and treatment of the condition. This connection between blood flow and nerve health explains why simply controlling blood sugar, while essential, might not be enough to reverse existing damage. Once the vascular plumbing is damaged, it needs to be repaired. The work of scientists like Dr. Cook shows that we need a two-pronged attack. We need to relieve the physical pressure on the nerves, as Dr. Dellen's surgery does, but we also need to restore their internal lifeline. This understanding has paved the way for even more advanced therapies that aim to do both, creating a much more powerful strategy for healing. Imagine being able to not only free a trapped nerve and improve its blood supply, but also give it a powerful boost to rebuild itself. This is where the exciting field of regenerative medicine comes into play, particularly the work of researchers like Dr. Richard Jacobi. His research has focused on using stem cells to supercharge the healing process. Stem cells are like master cells in the body. They have the amazing ability to develop into many different types of cells. In the context of diabetic neuropathy, they hold incredible promise for repairing the damage caused by the disease at a fundamental level. Dr. Jacobi's research has explored how injecting stem cells into areas with nerve damage can trigger a remarkable healing cascade. These stem cells can release powerful growth factors that act like a construction crew foreman, directing the body to build new blood vessels. This is the process of angiogenesis that Dr. Cook's work highlighted as so important. By creating a new network of healthy blood vessels, the stem cells help restore that vital flow of oxygen and nutrients directly to the damaged nerves. This provides the starved nerves with the resources they need to begin the long and difficult process of regeneration and repair. The true breakthrough, however, lies in combining these different approaches. Picture this. A patient first undergoes Dr. Dellen's nerve decompression surgery to relieve the physical pressure on the nerves. This gives the nerves the space they need. Then, to tackle the problem of poor circulation, the patient receives a treatment involving stem cells. These cells get to work rebuilding the blood supply, restoring the river of life to the newly freed nerves. This powerful 1-2 punch addresses the two main causes of the nerve damage, the external compression and the internal starvation. It's a comprehensive strategy that helps create the ideal environment for healing. This combined approach offers tremendous hope for the future. It moves us beyond just managing symptoms and into the realm of true restoration. For millions of people living with the daily pain and numbness of diabetic neuropathy, this represents a paradigm shift. The possibility of not just halting the progression of the disease, but actually reversing the damage and regaining lost function is no longer a distant dream. As research continues and these innovative therapies become more refined and accessible, we are on the cusp of revolutionizing how we treat this devastating complication of diabetes, offering a future with less pain, better mobility, and a greatly improved quality of life.